Hello, friends. Welcome to the podcast. My name is Raj. Today, we will talk about addiction. This topic is so big that it's difficult to cover it all in one episode. So, this will be episode one on addiction. So, I've been working in the addiction field for almost 10 years. I've known people who would rather buy drugs for themselves than buy milk for their babies. I know people who lost their toe or foot or even a leg because of diabetes, but they still continue to eat sugar. Um, I've also known soldier who survived, who was deployed, survived the war, came back home and overdosed on heroin, died in his basement from overdose of heroin. So I've treated people who were struggling with alcohol, who were at one point in their life so low they drank mouthwash or hand sanitizer. So yeah, addiction can make you do a lot of things that you really don't want to do because most people know, these things are bad for them, but they can't really do anything but just to keep doing the behavior. So it's not because these are bad people, it's because their addiction hijacks their brain. They're not in the driver's seat anymore, their addiction is. So today we're going to try to understand addiction, debunking some myths about addiction, and talk about recovery. What does recovery look like? First and foremost, what exactly is addiction? So, addiction can be defined as a chronic relapsing disorder characterized by compulsive seeking, continued usage despite harmful consequences, and long lasting changes in the brain. So, addiction literally changes your brain. So, in other words, if you try to quit something many times and you can't, it's probably an addiction. Another example, if you're looking at your Instagram every 15 minutes and you realize uh, that you're looking at your Instagram too much and you delete the Instagram app, and a few days later you download it again, you're probably addicted to Instagram. So another thing to remember is that usually addiction is a symptom of bigger problem. Uh, there might be some type of void in a person's life. Okay. Many people use alcohol or drugs to numb emotional or physical pain or fill whatever the void they have in their life by the addiction. It's important to recognize that addiction is not simply lack of willpower or moral feeling, but rather a complex mix of genetic, environmental, and psychological factors. Addiction can manifest in various forms: alcohol, drugs, gambling, shopping, sex, food, TV, internet, social media. And one addiction that not a lot of people talk about is emotional addiction. Um, Sometimes if you maybe ask yourself, man, why am I so much, why is there so much drama around me? Maybe you're addicted to emotions, the emotional roller coaster. So, regardless of the form it takes, addiction hijacks the brain's reward system, leading to a cycle of craving, use, and negative consequences. The ripple effect of addiction are profound, affecting not just the individual, but families, friendships, workplaces, and communities. It's associated with significant health issues, emotional distress, and societal costs. Yet the greatest toll is often on the human spirit, eroding self worth, relationships, and hope. So let's dispel some myths. Myth. First myth is addiction is a sign of weakness. Fact. Addiction is a disease, not a character flaw. Myth. You can overcome addiction through willpower alone. Fact. Recovery often requires support, whether it's medical, psychological, and social. It could be combination of all three of them sometimes. So understanding these truths help us to kind of dismantle stigma and pave the way for compassion and support. Okay. Another myth actually a lot of people have is if someone has a stable job and a family life, they can't be struggling with addiction. The fact is, many people live in denial because they're successful in their professional lives, or because they don't drink after 5 p.m., uh, or because they come from a good home. The reality is that anyone can be vulnerable to addiction. Addiction does not discriminate. It doesn't matter if you're white, black, rich, middle class, poor, religious, or atheist. So let's talk about recovery. So recovery is a personal journey, and there's no one size fits all solution. It might include detoxification, therapy, medication assisted treatment, support groups, and lifestyle changes. And the cornerstone of this journey is holistic care, addressing not just the addiction, but the person as a whole. So that goes back to that person is not the addiction. There might be some other bigger problem going on. So that's why you want to treat the whole person. So healing is not a solitary endeavor. If you have an addiction, isolation is the worst enemy. The support of compassionate community can be a beacon of hope. Family, friends, healthcare providers, and peer support groups play a critical role in recovery process, offering encouragement, understanding, and accountability. Recovery is not merely an absence of substance use or addictive behavior. It's about rebuilding and finding meaning, purpose, and joy in life. It's a process of continual growth, learning, and self discovery. A journey that is as challenging as it is rewarding. I invite you to look at addiction not as a dead end street, but as a detour on the road of life. It's a journey that tests the limits of our strength, courage, and resilience. Yes, yet it's also a journey that offers opportunity for transformation, healing, and redemption. Let's support one another on this path, fostering hope and nurturing recovery. Before ending this episode, let's do a meditation uh, to support recovery. So today we embark on a journey inward using mindfulness meditation as a tool to confront and heal from addiction. This practice is about bringing awareness to the present moment, observing our thoughts and feelings without judgment, and learning to understand the nature of our cravings and how we compassionately release them. Let's begin. Find a comfortable position, sitting or laying down in a place where you feel safe and at peace. Close your eyes gently and let's take a deep breath together. Inhaling slowly, deeply, filling your lungs with air, and exhaling, letting go of any tension you're holding. Continue to breathe deeply at your own pace, and with each exhale, feel yourself sinking deeper into relaxation. As you settle into this space, bring your attention to your body. Notice any areas of discomfort or tension. Observe them without judgment. With each breath, imagine sending warmth and compassion to those areas, inviting them to relax. Remember, mindfulness is not about mindfulness is about observation without criticism. You are learning to present with whatever arises. In a thought or an emotion, acknowledge this too without judgment. Then gently guide your attention back to your breath. Your breath is a powerful anchor to the present moment, a refuge where you can return again and again. In this space of mindfulness, reflect on the nature of your addiction or craving. It may present itself as a need, a void, or an escape. Observe these feelings with curiosity and compassion. Ask yourself, what am I truly seeking in this moment? Is it comfort, escape, relief? Allow these insights to surface without enforcing them. Through understanding, we will find the path to healing. As we near the end of our meditation, envision yourself surrounded by a warm, nurturing light. This light represents your innate resilience, wisdom, and compassion, the tools you have to overcome addiction. Imagine this light giving you the strength to face your challenges with courage and grace. Take a deep breath in, gathering strength and peace from this practice. As you exhale, start slowly to bring your awareness back to the room, feeling grounded and centered. When you're ready, gently open your eyes. Well, thank you for joining me in this episode about addiction and mindfulness meditation. Remember, this practice is a journey, not a destination. Each moment of mindfulness, each act of observing your thoughts and feelings without judgment is a step toward healing. Carry this awareness with you and let it guide you through the challenges and towards the light of recovery. Be gentle with yourself and know that you are not alone on this path.